Welcome to the Truth About Vaccines 2020, Episode 9, the final episode. We're your hosts, Ty and Charlene Bollinger.
In the last episode, we analyzed what's been happening across the USA with draconian mandatory vaccine laws and removal of religious and medical exemptions. We also covered the blatant censorship and suppression of any and all anti-vaccine sentiments by big tech giants.
Here's Bobby Kennedy recapping what's been happening over the past few years in the vaccine world and the censorship of any and all information that doesn't conform to the religious dogma that vaccines are safe and effective.
Well, there's been a huge global drive by the vaccine industry to mandate vaccines and end public debate. So we've had a long-term censorship on network television, which receives, and in the press, which receives about almost $10 billion a year from the vaccine companies, and for advertising, et cetera. And so that allows them also to dictate content. So we've never been able to debate or discuss this issue in the mainstream press, but we were able to go to the social media. But in the last year, we've been completely shut down in social media. Google has become a vaccine company. Google now has a partnership with Glaxo. Google is making vaccines, and they're partnering with Merck. And they've completely shut down all discussion, what they call vaccine misinformation. That is not misinformation. It's information that is critical of a medical product, of a pharmaceutical product. Facebook has shut us down, Pinterest, MailChimp, all of the major social media platforms have shut us down. And then there's also been a push to mandate vaccines. This is a product that they know they could not sell in a marketplace, so they have to mandate them. And they know that they can't win the debate, so they have to censor it.
And they're not even hiding the censorship. Big tech is openly admitting that they are going to censor anyone who questions the safety of vaccines or even hints that we should have better safety monitoring systems. So, based on those criteria, it looks like they're going to want to start censoring the World Health Organization soon.
Why, you might ask? There was a meeting which took place at the World Vaccine Safety Summit on December 3rd, 2019 in Geneva, Switzerland. Have you ever wondered what the World Health Organization's scientists and pediatricians say when they discuss vaccines behind closed doors?
Hold on to your seats, as you're going to get to see for yourself that what they tell us is vastly different than what they discuss in secret meetings. Interestingly, in attendance at this meeting was the World Health Organization's #1 chief scientist, who is the face of the WHO, Dr. Soumya Swaminathan. Does that name sound familiar? If you watched episode 8, you saw her telling you this about vaccines.
Vaccines are very safe. That's why we have vaccine safety systems, robust vaccine safety systems. WHO works closely with countries to make sure that vaccines can do what they do best, prevent disease without risks.
Now, here's what she said less than a week after the World Health Organization ran that vaccines are very safe propaganda commercial. Thanks to Del Bigtree and Highwire for this shocking footage.
I think we cannot overemphasize the fact that we really don't have very good safety monitoring systems in many countries, and this adds to the miscommunication and the misapprehensions because we're not able to give clear-cut answers when people ask questions about the deaths that have occurred due to particular vaccine, and this always gets blown up in the media. One should be able to give a very factual account of what exactly has happened and what the cause of deaths are. But in most cases, there's some obfuscation at that level, and therefore there's less and less trust then in the system.
Whoa! I thought vaccines were safe. I thought they had robust safety monitoring systems. I thought vaccines prevented disease without risks. That's what Dr. Swaminathan told us in the commercial. But then she said the exact opposite in closed-door meetings.
Here's Dr. Heidi Larson, the founding director of the Vaccine Confidence Project and former head of global immunization communication at UNICEF, describing safety science in the current vaccine program.
There's a lot of safety science that's needed, and without the good science, we can't have good communication. So although I'm talking about all these other contextual issues and communication issues, it absolutely needs the science as the backbone. You can't repurpose the same old science to make it sound better if you don't have the science that's relevant to the new problem. So we need much more investment in safety science.
Wait a minute. Dr. Larson, do you mean that science is lacking? We thought the science was settled. We thought that anyone who suggested that we needed more safety science was a conspiracy theorist, a nut job, an anti-vaxxer.
If Dr. Larson has a Facebook page, she better watch out because she just violated their no anti-vaxxer policy by stating that we need more safety science. Next up is Dr. Marianne Gruber, the director of the Office of Vaccines Research and Review at the FDA.
One of the additional issues that complicates safety evaluation is if you look at and you struggle with the length of follow-up that should be adequate in a, let's say, pre-licensure or even post-marketing study, if that's even possible. And again, as you mentioned, pre-licensure clinical trials may not be powered enough. It's also the subject population that you administer the adjuvant to, because we've seen data presented to us where an adjuvant, a particular adjuvant added to a vaccine antigen did really nothing when administered to a certain population, and it's usually the elderly, compared to administering the same formulation to younger age strata. So these are things which need to be considered as well and further complicate safety and effectiveness evaluation of adjuvants combined with vaccine antigens.
Did you get what Dr. Gruber just said? One of those pesky little things that complicate safety evaluations is the fact that the clinical trials, quote, may not be powered enough. And that fact really needs to be considered when evaluating safety. Let me translate. We don't have enough clinical trials to determine if vaccines are really safe or not, especially with the combination of antigens and adjuvants.
Here's Dr. Martin Howell-Frieda, coordinator of the World Health Organization Initiative for Vaccine Research, describing the association of adjuvants with vaccine injury and the need to build confidence in the vaccine program. You won't hear this on 60 Minutes.
Every time that there is an association, be it temporal or not temporal, the first accusation is it is the adjuvant. And yet without adjuvants, we are not going to have the next generation of vaccines. And many of the vaccines that we do have, ranging from tetanus through to HPV, require adjuvants in order for them to work.